Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And today I would like to welcome Keeli Gailes and Jennifer Beech. Thanks for joining us today, Keeli and Jennifer.
Thank you, Kim.
Thank you. Thanks for having us.
You're welcome. And by way of a brief introduction, Keeli Gailes is a physical therapist and founder of Health for the People, and Jennifer Beech is helping healthcare and nonprofit leaders scale. And today we're going to be talking about how you're both involved with HRC, which is the Healthcare Reinvention Collaborative. And HRC says we're not going to change healthcare ourselves. We're going to connect the people who will. And I would love each of you to share how your personal work led to your interest in collaborating with HRC, and some of the positive movement you've witnessed in your own work and also through HRC. And this is because we need hope for healthcare, and it's great to celebrate and spotlight what's going right and who's doing that. So thank you both for your work. And Jennifer, would you like to go first in introducing yourself?
Yeah, sure. I'm Jennifer. My background is actually higher education, where I was for 12 years, both as a university staff member and as an adjunct professor. Really burned out right before the pandemic, and of course, during the pandemic. And ended up leaving in early 2021 and started freelancing as a freelance instructional designer and later on technical writer. And I came to healthcare because healthcare has a lot of training needs, in the same way that education does. And so I kept getting a lot of healthcare projects. Um, and um, and there was a lot of content. I was digging through a lot of medical research um, and I just sort of kept tugging that thread and it just kept pulling it and started to connect with people who were in healthcare, but were also just interested in health in general. And I think that's really what I was searching for after being so burned out in education was just health and healing, and care. And I really found that home in HRC with people who are very welcoming, who really had big ideas on how to reinvent healthcare. And we have such huge challenges. We're still working our way through all of it, as so many are. And I just love being in an environment where you feel whole, where you feel healed, where people care about your health as a total human being, which is how healthcare should be.
Mhm.
Yes.
Yes, I love that. Yeah, I
Yes.
love that very much. And my sister is a teacher, and of course, I'm a physical therapist by training. And there's so many parallels today, exactly what you're saying between education and healthcare and the struggles that teachers and others in education face with healthcare. It's almost like, two parallel tracks, and it's so difficult. And for just like doctors want to be able to do what they were trained to do to help the patients, and it's like teachers want to do what they were trained to do to help the students, and there's such a loss of autonomy in both. And I understand why they feel like cogs in the wheel, and it affects physical therapists as well, right, Keely?
Yeah.
Once the EMR came into to play, so this work is so important. So thank you for what you're doing. And Keely, tell us a little about your journey.
Yeah, so I went to UNC and got my doctorate of physical therapy there. And I have to say, as someone who had decided I was going to be a PT at 17, I was very bright-eyed and bushy-tailed and optimistic about the whole healthcare industry until I was almost graduating. And I took a not marketing, but a business class as part of our curriculum. And that was the first time that I really had the wool removed from my eyes and realized, oh, this system is not what I thought it was. Because when you're a healthy 20-something-year-old, it seems like maybe it is working. And that was a big eye opener for me and led to me creating the thought of Health for the People, which is a nonprofit that I founded and which is what led me to eventually working with Denise and HRC, because actually Todd Otten had introduced us, and I think he introduced me to you very close proximity to when I met Denise. And I, with Health for the People, had have this goal of having a place where everybody can have a ever-present location, because it's virtual, to discuss the plan, right? About what does the next phase of healthcare look like. And over time, decided to build it up in a way where there were some like suggestions basically from a lot of listening work I did with podcasts like yours and a lot of other great resources. Zev is one of the resources that I listen to a lot because he's got great content on there. And essentially, the thought is that solutions exist. We just need to figure out which ones do we put in what order and how do we patch them into a quilt that we can throw over this, put out the fire, and build something new and beautiful together. So that's Health for the People in a nutshell. It does have like some different branches. There's more of a local branch as well, which is trying to extend some financial resources to people here in North Carolina who are having a hard time accessing care. And then more recently, I have launched what is called Bendy, Dizzy, and Itchy 101, which is a health coaching program specifically for people who have hypermobility, EDS, mast cell activation syndrome, and dysautonomia or POTS symptoms, because I recognized as somebody who happened to specialize in these areas that there's just very little information out there that's reputable. And then you may have great information that you're finding online, but you can't find the doctors who will actually talk to you about it. And I heard a story just last week that a patient of mine said the doctor she wanted to get in with was only available online. She's like, okay, fine. Was charging about $5,000 to see her. She was like, you know what? It'll be my Christmas gift to myself, but couldn't see her until 2029. So there's a real need for people in this industry, or like in this subset of patients. And I just wanted to fill that void because it's something that I feel really passionate about, is helping people who are falling through the cracks. And honestly, I am developing a coaching program with it to help PTs who just feel ill-equipped to be able to treat these very tricky patients. Because I think that's a big part of the problem. It's doctors, PTs, anybody that just, they don't want to see these patients because they don't feel like they have useful tools. And the patients don't understand that. They just feel like nobody cares about me. And so it's one of those areas where we really can bridge and help the patients understand how to advocate for themselves, but also try to have resources for the providers to not feel lost and feel equipped to help out these tricky but very keen patients. They generally really will do whatever it takes to get better.
Yeah, well, I love the work that you're doing, and that's one of the reasons that I also have others who intersect with healthcare on, although my podcast is called Stand Up for Doctors, because we need to support doctors, and sometimes that is they need to know that there's other professionals out there that can help their patients, and then that helps them. Like I've had a pulmonologist on that talks about like physicians and their own sleep issues, but also when doctors should refer people to a sleep specialist, right? And I've had a registered dietitian on, so they know, because sometimes they don't have the time or background really to help people with things like nutritional issues, but that there are other professionals out there who do have the bandwidth and the training to help their patients. So it's really good to spotlight these things. So thank you for the work that you're doing. And I'm wondering if we should actually even back up a little. I've had Denise Weissman on and speaking to HRC in the past, but that was a while back. Jennifer, would you like to just briefly describe for our audience a little more about HRC?
HRC stands for the Healthcare Reinvention Collaborative, and we describe ourselves as a network of networks. So we want to connect all the people who are working to reinvent and reimagine what healthcare looks like, and to give them all a place to connect, to build a community around so that they don't feel so isolated and alone in this work, because we know that there are big, complex problems out there. And when you're sort of toiling away, trying to do your part in kind of your corner of healthcare, it can feel very isolating and like you're not really having an impact. So we really wanted to, build that community and have a community that can share some resources to help others and to support and illuminate the work that they're doing. So HRC isn't here to reinvent healthcare, as you said, but just to elevate the people who are and thinking, okay, how can we take what they're doing and their message and get it out to more people, and especially the people who can really, take their ideas forward even more.
Hmm.
So we've been working on a network map to connect everyone and show everyone how people are connected, what each organization is doing, and if anyone is seeking to connect with anyone, that we have a map with various filters where you can look at, okay, who's in my area, who has a specialization in a certain area, who offers a certain service or a certain expertise. So that's what we've been working on, and we've showed it to a couple of small groups, and we're hoping to, we have a version of it on our website, and then hoping to have a more robust one coming up in 2026.
Well, that's great. And I've also had Dr. Paul Burens on, and I've had Dr. Whale Sassoa on.
Yeah.
And was there anyone else? And I know Dr. Don Allison has done
So,
so much and is generally in retirement mode right
yeah.
now, but big thanks to her. Was there anyone else specifically at this point we should give a shout out to?
I know there's some people who probably predate me,
Okay.
who were really part of that sort of um, founding kind of vision and pulling everything together. And there are so many even
Hmm.
currently now that I know if I try to name anyone,
Yeah, right. That's fine. And
I'll
then
forget.
we
But
can
yeah,
tag people when this
definitely.
episode goes live. And Keely, I know that you've been part of and Jennifer, I'm thinking you likely as well, as the Shine a Light, where Denise, they had an episode where they shine a light on the things that we are doing, and they've featured my work with Stand Up for Doctors in the past. And actually, next month it will be me. We ended up making a big impact for Doctors Day and formed a little group, Healthcare Professional Wellbeing Collaborative, where we're working on, the mental health of healthcare workers. And I've aligned them with the Dr. Lauren Bean Heroes Foundation, and and some of them have become ambassadors. So we'll be shining a light on that. So Keely, when the HRC featured you, if you'd like to share anything that came of that, like where you're intersecting and dovetailing with HRC, and progress you've seen like in your own work or with HRC or through your connections there.
Yeah, I would say that Denise was able to connect me f to a few different people through that Shine the Light, and in different industries, which is always neat.
Mhm.
And I'm not going to remember names. I'm so terrible with names off the top of my head, but there are definitely a few different avenues that I'm exploring based on those connections already. And it has given me the opportunity to talk about what I was telling you about my health coaching things a little bit as well. So there are some things coming of that. There's some other partnerships. One thing I was going to say, it wasn't directly from the Shine a Light, but through my work with HRC, I was able to connect with a member who happens to be here in the Chapel Hill area where I am, which is kind of cool because even though HRC is national, it's heavily weighted to the Northwest just because of the people who founded it, right? And as someone who's from the Northwest, I'm all for that. But to be able to connect with someone in my community, and we've developed a friendship as well as a professional relationship as well. That's Trisha Choi. She's amazing, and so it's really cool how it's bringing people together. And I think that um, from the beginning, like Jennifer was saying, it really helped me feel like I had a home, a place that I wasn't just screaming into the void, hoping that, that things were going to come
Mhm.
back at me. And one thing that I think is crucial about it is that it helps ideally decrease redundancies, right? Because so many of us are trying to wear so many hats and passionate about these projects, but we don't want to recreate the wheel. We just want the wheel to get built, right? Like, we know we're all in this together. So if somebody else can do that work, wonderful. Let them focus on that. Let's take our energy over here and figure out what is the part that's not being built already. And I think that's what's cool is that when I was first coming up with Health for the People stuff, I thought I was going to have to do a lot of that connecting and stuff too. And then once I realized they were like, nope, this is what we do, is like, awesome. Now I
Mhm.
can just focus my little niche over here. And I think that that's the goal, is a lot of people can just kind of hone their passions a little bit more focused. Um, Once we realize that there's somebody out there doing that other piece, let me just partner with them. And so I really love the work that HRC is doing, and I want to see it explode. And I think one of the coolest things about HRC that you might not know if you're not in our meetings is that there is really no ego.
Mhm.
And that is one of the most amazing parts. Is as a younger clinician coming in, I was a little intimidated. And as somebody who doesn't have a medical doctorate, right, I kind of expected people to take my ideas a little less seriously, but I never felt that. I've always felt
Mhm.
very respected, heard, and that everyone was given the space to share their thoughts and is very respectful of each other. And that's not by accident. It's
Mhm.
very, very intentional. And that's the point of HRC, is to allow all the different perspectives to have space so we can get to know each other with respect as like the baseline. And that is one of the only organizations I've ever seen that really truly has that was it horizontal structure. There is no hierarchy. And so it's been a wonderful learning experience and just an experience overall to be in that type of organization as well.
And speaking that to directly, when I had Dr. Paul Buren's on, I had him on with someone who worked in the pathology lab, as a technician, and he had a lot of respect for her. And he says in the episode, like only me would think to put, like a doctor out with someone from the lab. But then he was able, who better to spotlight that we all need to, exactly what you're saying, right? To respect the work of each other, and we're all part of the team, and people aren't thinking that the people that work in the pathology lab, right, doctors make decisions, life changing decisions based on the results of what happens in the pathology lab. So those people are very important, and we need to respect all parts of the team. And then Whale and I have collaborated. I had him on with Lisa Scardina, and who's a healthcare leader. And again, we went on to collaborate on two Kevin MD articles and podcasts. And
Yeah.
it's just that he respects the work that she's doing, and vice versa. And these collaborations, and connections, that's what we need to do, is spotlight people doing things well and amplify it so we can all make a difference together. So Jennifer, is there anything else like you'd like to share about your personal work? How that dovetails with HRC and changes you've seen, as far as your work and how it relates to HRC movement forward.
Yeah, and it's great. I wanted to go back to something Keely said about people wearing a lot of different hats, because that's where I come into play. And a lot of the members of HRC have their own organizations or they have their own businesses. And they're wearing all the hats, right? And it's their baby and they're doing all the things. And what I like to do is come in and help and say, no, you don't have to wear all the hats. That there's a way to grow this without wearing all of them. And it's probably more advantageous for you to not wear all the hats. And I like to be able to free them up and do a lot of the back end things so you don't have to worry about emails and because no one starts a business to, check email and post on social media and, look at spreadsheets all day. It's like I want to free them up so that you can go out and talk to people and spread your message and do the kind of visionary work that they want to do. So I love to be able to take that from them and be like, don't worry about this. Just go and be the ambassador for your organization.
And everybody loves her for that.
Yes.
And many other reasons.
Yeah.
Yeah, well, that's fantastic. I think we'll have to have even more conversations in the
Yeah.
future, even as it relates
Yeah.
to me instead of for doctors, because Denise and I were part of Medicine Forward, and still am and as Denise has gotten more involved with HRC, she's kind of sidestepped for that, but we still have a
Right.
close relationship. All three of us stand up for doctors, Medicine Forward, HRC, and I actually tag them along with Clinician Burnout Foundation, founded by Jody
Mhm.
Green,
Mhm.
in all my posts to show that I kind of stand with them. And it's kind of like, different branches that we're all trying to make a positive difference in healthcare. And I feel like sometimes when doctors like they need hope and nurses and other people that work in healthcare, so if
Right.
they can see the things that we're doing and talking about, to know like there are people out there trying to make things better and action and impact, right? And this
Right.
is what we're actually doing. So Keely, is there anything else that you want to say in general, or also answer the question, what has helped you overcome challenges?
Well, one thing you were just saying that I really have to respond to because it was a beautiful segue is we're building wide bridges. And I know Paul would love would love to
Yes.
hear that as well, but you just described it so beautifully. Like that's what HRC is about, is building those true relationships between individuals so that we think about when we hear something, oh, I need to make sure that person knows this.
Mm-hmm.
And that's really the beauty of it, is building those wide bridges so that we're not being redundant, right? And we're actually making progress forward. So thank you so much for being one of those wonderful connectors of people and highlighters, and we really appreciate what you do with Stand Up for Doctors.
Yes.
Well, thank you. You're welcome. And I love it when people connect me as well. And I believe it was likely HRC connected me with Trisha Choi too. So we've had a conversation in the past. So I love it when we, just like you said, build the, more and more connections. It's beautiful. Is there anything else, Jennifer, that you'd like to share overall, or to share what's helped you overcome challenges?
Oh my gosh, what helps me overcome challenges. I process a lot of thoughts in writing, so I'm a big writer. Sometimes talker, but yeah, definitely. And like we've been saying, community, running things by people, not being isolated. You're not alone. There are definitely people out here who would love to help, who have the skills to help, who just need the invitation and they will just jump in.
Mm-hmm.
Yep. Trusting your support system, and this is
Mhm.
helping us build a support system.
Mhm.
And
Mm-hmm.
that's what we all
Yes.
need.
Absolutely. And this is a random question that I want to ask you both, because I was speaking with a doctor this morning who mentioned that, oh, we're all replaceable. And I said to him, I said, a good doctor is not replaceable. And, I'm doing this because one of my own doctors took his life, and my first Kevin MD article was a tribute to him. And I had titled it My Irreplaceable Radiologist. And the title was changed. But you would think they would not think that. Like, how could you think you're irreplaceable, right? You're not, you can't order a doctor on Amazon, right? But I've come to understand why they might think that, and it's just not true. And I was wondering if you could each share a message. Keely, we could start with you, like two doctors speaking to that.
Yeah, I would say that first of all, you cannot replace relationship. And that is the thing that we want to restore, is doctors' ability to actually have relationship with their patients. And one of the things that I know I get the privilege of having as a physical therapist, is the time to actually build relationship with my patients. And the doctors, whether they're my people who refer to me or who I refer to, or my personal doctors, I have a relationship with them, and that matters because I only send my patients to people I trust. I deal with a very vulnerable population, and they do not feel like their doctors are replaceable. And I think that while we are not replaceable, we are replicable, right? And so I would empower more doctors who might feel that way, one, to know it's not true, and two, to teach. Because what you know is something that other people need to know. And whether that's, you're like, okay, well, there's no med students coming through anymore, but find a way to get the information out there because people need what you know and they don't know that they don't know it. So
Mhm.
that's my passion right now is trying to replicate what I'm doing here and make it easy to access for patients wherever they might be.
Yeah, well, thank you for sharing that. And Jennifer, what would you like to add?
Oh my gosh, it kind of broke my heart a little bit when to hear that because I think about my doctors and I would be like, I would hate for them to ever think of themselves as replaceable. Because I have, my personal doctors that I've been to for years that know me, that know my family, um, that I've just seen, and I couldn't imagine seeing anyone else. I would say from the patient side, just to echo what Keely was saying, like we really desire to know how to take care of ourselves. There's so much information out there that, and some of it is true and some of it's not, and some of it's really misleading. And to be able to have someone to partner with you, to parse through all of that, to tell you what it means, that kind of expertise, um, you just can't. I know it takes years of experience to build up. And I know it seems like, oh, well, you can just go get this scan and go get this test and go get your blood work and go do this. And it's like, yeah, but who's going to interpret that for you? Who's going to look at that for you? Who can put it in the context of your unique medical history, right? We can't just sort of take this sort of random advice on the internet and just apply it to your life. It may or may not work the same way for you. And I think people really discount that role of like you need someone with not only the medical expertise, but also the expertise in you to be able to really so that we can all be as healthy as possible, to really advise you on how to be healthy. And I feel like in this age of AI, we all have to lean into our humanness and what makes us human. And I try to think of those moments every day, whether they're logical or illogical, because what's great about humans is they can be completely illogical, right? We don't have to be machines. We don't have, and that irrationality, as frustrating as sometimes it is, it's like I want to keep it because it's what makes us human, right? And so I would tell doctors really lean into what makes you human because it's just and it's effortless. You can just be. It's not doing anything. You're not doing more. You're just being. And that's really needed.
Right. That's so true. And there's so many obstacles now to the physician-patient relationship being what it used to be, right? Time constraints, administrative burdens, like
Yes.
all of those things. And of course, then what Keely said about relationships, it is all about the relationships. And I wouldn't trade, I've said I wouldn't trade my own doctors for $1 million. And speaking to Jennifer, what you just said about, doctors being human, as you know, we've written a collaborative book, White Coats, Courageous Hearts, and we have drafts in for book two, which will be called White Coats Human Hearts. And we're talking about the humanness, and we want people to see that doctors are human too, and sharing their stories and physician spouse stories and patient stories. So that's the first time I'm announcing it, and it's in the works. And I also
Yay.
always try to thank my doctors, send them thank you notes, thank them in person, And we tried to make a big impact for Doctors Day, which is March 30th, and having everyone send their thank you, doctor, a thank you note, and also doctors, because they have colleagues that have helped them and they have doctors too. So it's always a good time to thank a doctor, even if you are a doctor.
Yeah.
So, well, thank you for all that you've shared today, and I can't wait to share this episode. And I would like to ask Keely, how can our listeners get in touch with you?
Yeah, you can reach me directly at my email, which is going to be Keely at healthforthepeople.org. And you can check out our website, just healthforthepeople.org, look into any of those programs that I spoke about earlier. And you can find me in HRC too if you want to come join us there.
That sounds fantastic, and we'll definitely tag HRC and add in their website. And Jennifer, how can our listeners get in touch with you?
Three, let's see.
Yeah, definitely. HRC website, LinkedIn. I'm on LinkedIn all day, every day, most days. And then also my email is Jennifer at b-sidelearning.com.
Okay, well, that is terrific. So thanks again for being my guest today.
Thank
Thank you,
you.
Pam.
You're welcome. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.